In this lecture, our focus is on the definitions of community and public health nursing. This will lay the groundwork for understanding the unique role and scope of CPHN in the Philippine context. Let us explore what makes CPHN a specialized and transformative field of nursing. What is community and public health nursing? CPHN is a specialized field of nursing practice. It is specialized because it goes beyond what we traditionally associate with nursing, which is often seen as hospital based and focused on cure and treatment. In CPHN, our focus is broader. We are addressing the health needs of individuals, families, and entire communities. Let us think about how it is going to be in the Philippine context. For instance, if you are working at an RHU, you do not just monitor the blood pressure of your patients. You also organize health campaigns, conduct house to house visits, and implement health programs. This role emphasizes health promotion and disease prevention, which means we intervene before illness occurs. Instead of waiting for our patient or the persons in the community to come to us to visit the RHU, we visit them at their homes and teach them how to prevent illnesses and to promote health and wellness. At the heart of all these efforts is people empowerment. Our goal isn't just to provide service, it is to enable people to take control of their own health. When mothers in a community feel confident monitoring their children's growth, or when senior citizens understand how to manage their hypertension without fear, we know empowerment is happening. This is the core of CPHN, building partnerships with the community so they become less dependent and more self sufficient in health matters. Now, let us look more closely to what CPHN does, how it helps the people. One of the primary roles of a community health nurse is to help people reduce their risks of developing disease. This means identifying what risk factors exist in a specific population and addressing them directly. For example, according to a specific barangay's health profile, you see that it is a GIDA or a geographically isolated and disadvantaged area. You also found out that many residents use untreated water from open wells as their drinking water. This significantly increases the risk for diarrhea and waterborne diseases like cholera and typhoid. Your job is to identify the risk, report it, and act on it. By initiating, for example, a community education campaign or coordinating with the local government unit to be able to address this concern. Beyond risk reduction, we also strive to help people maintain their optimum functioning. This refers to their ability to live, work, and interact in society with as much physical, emotional, and social well being as possible. For example, if we have a stroke survivor who received home visits and physical therapy guidance from you, you are not just treating him or her medically, but you are helping that person to regain independence, dignity, and productivity. Maybe now they can do small chores at home or participate in community gatherings. So, in community and public health nursing, we aim to keep people not just alive, but thriving. Now, how do we achieve our goals in the community? First, we use preventive measures like vaccination and screening. These are fundamental tools in public health. Let's take, for example, the DOH expanded program on immunization. We play a critical role in implementing sabayang patak, vaccination campaign, or anything that is used to be able to push these services towards the people, especially for those who have difficult time accessing it. The second point is sharing information to help our clients manage their own healthcare needs. This is where health education plays a vital role. For example, if you have several pregnant women in your community, you might plan to conduct a buntis class where these expectant mothers are taught how to identify danger signs in pregnancy, how to prepare a birth plan, and how to recognize the importance of exclusive breastfeeding. By sharing this knowledge, these mothers are better equipped to care for themselves and their babies. And then we go back to the idea of empowerment. Empowerment means we are enabling people to do things on their own. It is not about making our communities dependent on us. It is about building their capacity to act. This is done through health education, which is a structured, consistent, and culturally relevant approach.